Hello, my name is Dr. Joe Keenan. I'm a professor emeritus from the University of Minnesota Department of Family Medicine and Community Health. I'm also an associate professor in the School of Food Science and Nutrition at the university. And for a number of years, I've been the director of the Geriatric Fellowship Program, where we train our younger physicians on how to care for the elderly. Now, I'm very pleased today to have the chance to share with you my superfecta on healthy aging. The title, as you can see, has a funny word in it, superfecta, but those of you who know horse racing and betting on horses know that the superfecta is the most profitable bet that you can make on a single horse race. It involves picking the top 4 horses that you believe will finish the race and their order of finish, first, second, third, and fourth. Now, over my years of personal research, my study of others' research, and a fairly extensive patient care experience in care for the elderly, I've identified 4 invaluable agents or supplements: niacin, dihydroberberine, Taxifolin, and mixed tocotrienols, that I consider really something that we should encourage all of our patients who are approaching older years to be on. Now, each of these supplements has a unique benefit, but what I like about them is they are complementary. They actually support and improve the benefits of each other. So they really work very well as a combination of supplements to help us with our aging. Now, those of us who I have to confess, I'm a horse racing enthusiast, and it was my natural inclination when I found these 4 winners to call them my superfecta. And I'm pleased to encourage you and say I think it would help all of us to enjoy the benefits of these agents, these supplements, when we're entering the home stretch, or the last lap, as you might say, in our individual race in the human race. Now, each of these has unique benefits and they complement one another, but I want to emphasize that if you don't give them in the right formulation that allows appropriate release and absorption to attain therapeutic levels, and also to minimize the side effects or toxicity, then you really don't get the benefits that you want. And in fact, you may just get more side effects or problems than you get benefits. So I'm going to emphasize as we go through the talk, formulation as well as the other benefits that we can look forward to. Now, niacin is the first agent, first supplement. As you all know, niacin is a B vitamin, vitamin B3. Now, niacin comes in 2 different forms. One is nicotinic acid, the other is niacinamide, also known as nicotinamide. And nicotinamide comes in a form also known as nicotinamide riboside, which when it's digested in the bowel releases the nicotinamide for its use as a vitamin. Now, both of these forms of niacin have the benefit of vitamin B3, and that's extremely important for every cell in our body. It helps to produce energy. It helps with all the intracellular chemistries that are so important in developing various chemicals of transfer of information, oxidation and reduction reactions. Only nicotinic acid has the cardiovascular benefits that we associate with nicotinic acid from the Coronary Drug Project study. If you recall, that was a famous study, the first one that showed an agent that could reduce coronary events and also extend life expectancy. Now, the cardiovascular disease prevention benefits are something that I've studied extensively. That's actually one of the primary areas of my research in preventive cardiology. And I must say, my conclusion is that nicotinic acid is the best agent to start with in any patient that you're going to treat for dyslipidemia or other risk factors for cardiovascular disease. And the lipid benefits, as listed here, it lowers total cholesterol, it lowers LDL cholesterol. The nice thing about it is it specifically lowers the low, dense particles of LDL, which is the only agent that selectively does that. And it also is one of the best agents to lower triglycerides, and it is the only oral agent that will lower Lp(a). And finally, it is the best agent for raising HDL, the good cholesterol. Now, that is benefit in every area of potential dyslipidemia that a patient can have. But way beyond that are the non-lipid benefits of nicotinic acid. It does inhibit vascular inflammation and reduces reactive oxygen species. These are damaging to far more than just vascular tissues in the body. And quite importantly, these are a cause of dementia in older persons. It reduces oxygenation of LDL. Oxidation is necessary for LDL to be pathogenic. It reduces the intravascular adhesion molecule called monocyte chemoattractive protein 1. This is extremely important for preventing the initiation of plaques or thrombi in our vessels of any sort. What you have with this chemoattractant protein is a molecule that attaches to a vascular intima, and then any kind of agent that passes by that can attach to that and promote thrombus or plaque can do so with that existing there. And this is one of the ways that some of the bacteria and viruses cause heart attacks. There's a theory called Bale-Donine theory, where 5 pathogens that are common in the oral mucosa, if you have any kind of poor dental hygiene, they can escape into your bloodstream, into causing a bacteremia, and they can go to these adhesion molecules, cause a thrombus. They also can go to different areas of the body and start an inflammation that will change DNA into something that becomes a cancer. And then I'd like to just say, for aging again, the nicotinic acid has been shown in animal studies to reduce both the possibility of a stroke and the extent and recovery time from a stroke. Nicotinic acid for cardiovascular disease really should be in an extended release form or controlled release form. And I've studied this research area extensively, and I can tell you there are only 3 agents or 3 formulations of nicotinic acid that I would recommend to any patient. First would be Induracin, which is a wax matrix release. I've done bioavailability studies of this particular form of nicotinic acid and compared it to others, and it's unique in that its ability to deliver nicotinic acid nicely over 6 to 8 hours. This is very important for both reducing side effects and also preventing liver toxicity. If an agent takes longer than 8 hours to deliver, it frequently will cause liver toxicity. Now, slow niacin and niaspan are both polygel nicotinic acid forms, and they also have very solid science backing them. They are a capsule with a slow release, nicely, usually over 6 to 8 hours. The only problem with the polygel is they are somewhat subject to releasing too quickly if a person takes them with a meal, where just the peristalsis and digestive function of the body can break down the capsule too quickly. And for that reason, they have some of the same problem with increased flushing as immediate release nicotinic acid has. And they also, because they release a little faster than the typical 6 to 8 hours, in many cases, they tend to not have as good a liver suppression, not have as good a reduction in LDL. They're still very good agents, and I would recommend them, but not as highly as I would recommend the wax matrix or Induracin. Now, I've done quite a few studies, as I mentioned, with wax matrix, and you can see here some of the results of those studies. The wax matrix, as I mentioned, has better results than the polygel formulations. It has a very good safety profile. The side effects, if there are any, are easily reduced or minimized. I found that in our populations, typically 5 to 10% of persons have a somewhat increased sensitivity to nicotinic acid. And I used to drop them out of a study because I saw their liver enzymes going up. But now, since I've done studies and found out that I could actually keep them in the study but lower their dose, roughly half the dose that I give most patients, they actually have as good, if not better, lipid results, and it generally reduces their liver toxicity back to a normal range. Now, I've also done what you would call a post hoc analysis on some of my studies to see if there was any problem in older persons, either with not enough benefit from the nicotinic acid in their lipids or excessive side effects and dropouts. And to my surprise, not only did the older persons not have more dropouts from side effects or toxicity, but they actually had better lipid results than many of the younger persons on the same doses of the nicotinic acid. The next slide shows the vitamin benefit of nicotinic acid and niacinamide, and it's critical for our intracellular redox reactions, and it's critical for intercellular enzymatic reactions. Interestingly, the average diet in a developed country population has enough niacin that you don't need a supplement. But as we age, our body not only needs more niacin, or actually the NAD plus niacinamide adenine dinucleotide, but we also are less able to maintain that pool or recycling of NAD plus. And so we lose more and we need more. And so a supplement of nicotinic acid, niacinamide or nicotinic acid, is very helpful in maintaining these really important benefits for the mitochondria. As you know, mitochondria are a source of energy for every cell in your body. And one of the problems as you decrease mitochondrial energy production, they literally lose their function, and that part of your body is going to not function well. And this is especially the case in older persons who have muscular weakness from this. They have dementia from this. It's a widespread problem in elderly persons. Now, niacinamide was recently discovered, a very interesting study done in Australia, to prevent or reduce glaucoma. Now, you know, glaucoma is the most common cause of blindness in older persons. So this is a really nice additional benefit of the niacin supplement. And it really is something that is quite safe. It's easy for them to take, and generally would be in the range of 3,000 milligrams per day, divided into 2 doses, 1,500 twice daily. And when you do this, it's not like we usually treat glaucoma, reducing intraocular global pressure. It's really from improving the function and the health of your retinal ganglion cells, which are part of your vision function. Now, another interesting study, and both of these that I just mentioned were within the last year or two, was a study done by a lipidologist named Stephen McConnell. And Stephen took a group of people who had known serious kidney failure problems, staging from kidney failure stage 2 to 4. And when he gave them just a relatively low dose of nicotinic acid, 100 to 500 milligrams 3 times a day, and gave that with a sodium bicarbonate, he found that he improved them by 1 stage or more with just that a bit of nicotinic acid and bicarbonate. Now, as you all know, kidney failure tends to progress to either needing dialysis or a kidney transplant. And obviously, those are not good things for older persons. They tend to be disabling almost in themselves. So this is another nice benefit. Now, the next supplement that I find quite important is dihydroberberine. Dihydroberberine is actually a form of berberine that was an ancient traditional Chinese remedy for trying to prevent cancer. It's an herbal type extract that was used for thousands of years for that purpose. Now, the more modern research has found what I would consider almost better benefits as well as more reasons to use berberine. And what they found is berberine alone as the generic herbal extract was very poorly absorbed in the bowel. And so it was important for them in making this available to hydrolyze it, to put two hydrogen groups on to make it dihydro, and to allow it to be absorbed that way made it water soluble, and it absorbs very quickly, and it actually allows you to get to a therapeutic level, which was quite difficult on the berberine alone. It takes quite a high dose to do that, to maintain a therapeutic level. And that's one of the problems with dihydroberberine is it takes a high dose to maintain and repeated doses through the day to maintain a therapeutic level. But the changing of this, as I mentioned, to a formulation that controls release allows you to use a lower dose, and that actually protects you from the gastric irritation side effects of the high dose. And yet it maintains a proper dose level, therapeutic level for most of the day, so you can take just 2 doses a day and have the benefits that we're going to talk about. Now, there's really a robust body of clinical research supporting cardiometabolic health. What I think is almost most exciting thing about it is it's really very effective in controlling type 2 diabetes and even more so metabolic syndrome. It's as good, if not better, than metformin for metabolic syndrome. It helps dyslipidemia. In that respect, it helps cardiovascular disease. It can lower high blood pressure as well as many of our prescribed agents. And it also has a unique benefit for non-alcoholic liver disease. It can give you these benefits as well as the original concept of preventing certain cancers, and it's especially good at preventing or modifying glioblastoma, as you know, is a serious brain cancer. It can have a benefit also for alcohol-induced liver disease. And finally, it's one of our agents that gives us some antiviral protection, improves your immune system to be able to clear viral infections better. There are, as I mentioned, a robust amount of research supporting these claims, and there's a meta-analysis showing reduced high blood glucose, reduced high blood lipids, and reduced high blood pressure, and they were used in combination with and then in comparison to prescribed agents for these things, and in all cases they were both helpful when used in combinations and almost as good, if not better, when used in comparison. So I think that's just remarkable for a supplement when we're paying so much money for prescribed agents for these things. It really is quite helpful in promoting glucose control with type 2 diabetes. And as you see from that rather large meta-analysis, that was well supported. It's both safe and effective when used with statin drugs. It is also helpful in reducing body mass and waist circumference, as well as obviously giving you a better waist-hip ratio, which is one of the goals in treating metabolic syndrome. And as you probably know, metabolic syndrome is increasing in older patients. It is something that's almost pandemic, as you might say, as a health issue in our populations. In the United States, there have been studies of prevalence of up to 38 to 40% of a population. And now this varies to some extent by culture and locale and so on, particularly by age. But there are countries in Europe that have high metabolic syndrome as well, and you're familiar with that. Now, dihydroberberine, as I mentioned, has to be in a controlled release form, and just wanted to underscore that as we move on. The next agent is taxifolin, and taxifolin is actually a form of quercetin. Quercetin is, again, an ancient traditional Chinese herbal agent that was used to try to help prevent infections. And that really is one of the main strengths of dihydroquercetin, which is taxifolin. It's a plant extract or bioflavonoid that's found in grapes and citrus fruits and other vegetables and things. But once again, this is an agent that's not very well absorbed as a natural herbal supplement. And when you hydrate it, like we did with the berberine, hydration gives you dihydroquercetin, which is, as we said, called taxifolin. And that has really very effective benefits, especially in preventing infection. It was shown in a rather impressive Russian-American conjoined study in pneumonia. Younger men in their 30s who had pneumonia were treated with natural treatments of antibiotics and so on, or that plus taxifolin, and they found that the pneumonia cleared in approximately half the time that it did as the pneumonias that had no taxifolin, and the general well-being or list of side effects were considerably reduced as well. The other thing, taxifolin has recently been compared in these antiviral agent comparisons because of obviously the pandemic as well as other viruses that are quite common. And it is actually the best of literally millions of agents that have been compared. And so we have here something that really could help persons recovering from serious infections, especially those infections like pneumonias that so much bother elderly who get COVID and ultimately become very sick with respiratory distress, and that's the main cause of fatality in most of our elderly who got COVID and died. The other thing that this antioxidant benefit can be or can do is it can reduce the oxidation of LDL, which helps with our preventing cardiac disease. It has ability with reducing excessive oxidative stress of then reducing inflammation. So that has cardiovascular protection, hepatoprotective activity. It can be anti-cancer protection, antimicrobial protection. It can prevent angioneogenesis, which is one of the other forms of angiitis that bacteria and viruses can cause. And as I mentioned, can reduce LDL oxidation. Now, the last supplement that I listed is mixed tocotrienols. Tocotrienols are, you might say, a cousin drug or a related isomer to tocopherols, which is vitamin E. And it's different than vitamin E in that it has 3 double bonds in its side chains, where vitamin E is all saturated. Both vitamin E and tocotrienols, tocopherol and tocotrienols, have 4 isomers, and they're called alpha, beta, gamma, and delta, depending on their position of their methyl groups and the chromonal ring. The tocotrienols have the benefit, especially in neurologic tissues, of spreading more evenly across cell membranes, which is really helpful when you're trying to protect from oxidative stress. And the preclinical studies showed that there was dual neuroprotective action, reducing neurotoxicity and protecting mitochondria again from their assault by oxidative stress and dysfunction, losing their ability to produce energy for the cell. A population study showed that low levels of tocotrienols were associated with increased risk of cognitive impairment or Alzheimer's disease. And the study that I was most interested in of tocotrienols was one done in Malaysia, where subjects were first studied with an MRI of their brain, and they identified how many white matter lesions were present. As you know, white matter lesions are small scars in the brain that probably come from inflammation damage. And what they found when giving the 200 milligrams twice a day of this SuperBio tocotrienol, that the group that was treated had no change in their baseline level of white matter lesions. That's amazing to have no change over 2 years. The control group not only had increased white matter lesions, but they had more strokes, and their strokes were more severe than those in the tocotrienol treatment group. So it not only reduces the cause that we know is associated with dementia, the white matter lesions, but it reduces incidence and severity of stroke. So these are unique and very beneficial for our older population. Now, it's interesting too that it can lower cholesterol if you want to take it at about a 300 milligram a day dose. It is another agent that reduces LDL oxidation and contributes to preventing LDL's pathogenesis. It can benefit other tissues because of its prevention of inflammation. It can reduce arthritis. That's especially helpful in older persons who have a lot of trouble with their joints. It really does potentiate your immune system, your infection-fighting system, and especially helps respiratory infections. There again, we have the benefit for preventing COVID-related problems or any viral-related pulmonary disease. It finally is very effective at preventing pulmonary fibrosis, and this is helpful for people who smoke or have chronic asthma or any form of chronic bronchitis. And it also reduces your risk for cancer. We're finding that a number of forms of cancer are triggered by inflammatory or oxidative stress of the DNA in your nucleus of your cell. And that can trigger the DNA actually changing to become a source of a type of cell that's cancer, not the normal cell that it's supposed to produce. And look at this list of cancers that it has shown some benefit in preventing: brain cancer, breast cancer, colorectal cancer, and so on. I have to just tell you personal experience. I was diagnosed with metastatic non-Hodgkin's lymphoma in 2013. I went to my oncologist to be managed for this, and he actually was saying, let's monitor this for a period of time to see if it's changing or if it's stable. And it was not stable. It was changing. I had increased metastases and enlarging primary in my chest. And he wanted to start me on a very potent but very toxic form of chemotherapy. And I had just learned about tocotrienols. As you can see, the paper from the Malaysia study was printed in 2014. So I asked my oncologist if I could defer starting this potent chemotherapy and just try the tocotrienols for a period. He agreed, but he said we'll have to do a repeat set of CT scans to see where your baseline is after we defer for 4 months. After 4 months of taking 200 milligrams twice a day, I had complete remission of my cancer. No more metastases anywhere, and the primary had gone back to a normal-sized lymph node in my chest. So this completely amazed my oncologist and were obviously surprising to me. And now I've been on this level of 200 twice a day for the last 8 years, and I've had no recurrence. It has been basically a cure for cancer. So I have some personal experience to share with you, as well as the research of myself and others. Now, the important thing about formulation of mixed tocotrienols is they are fat soluble. As you know, vitamin E, DEAK, they're all fat soluble, and they have to be given with fat in a meal, or they're poorly absorbed or not absorbed at all. Now, what is very nice about the SuperBio mixed tocotrienols is that it's emulsified in a solution that when you put this in a capsule, it's very nicely absorbed, and it does help to take any of these vitamins with a fatty meal, but you don't really even need that to get good absorption of the SuperBio tocotrienol, because it's been emulsified in a solution that improves the absorption. So it is best to have the full spectrum of all four in this appropriate formulation. Now, I would just like to summarize then. Our four agents are niacin, dihydroberberine, Taxifolin, and mixed tocotrienols. In conclusion, I hope that you're as impressed with the benefits and the potential for helping our older folks with healthy aging as I am. Now, I've listed the supplements as we've discussed them, basically in the generic or over-the-counter terms. But as I mentioned earlier, it's extremely important for these benefits and to minimize side effects, to have the proper formulation. As you can see, I've listed wax matrix and polygel formulation for niacin, and wax matrix for both dihydroberberine and taxifolin, since I've discovered that wax matrix is just about the perfect formulation for a water-soluble supplement that tends to release too fast, needs higher doses if you use the immediate release, and it tends to metabolize fast and require multiple dosing, and it also tends to cause more side effects. So those top three are wax matrix forms that I think work the best. And for the mixed tocotrienols, you either have to eat those or take those with a meal that has a lot of fat in it, or you can take the emulsified form that's SuperBio mixed tocotrienols. That emulsified form, to me, guarantees that the patient is going to get the benefits. They're going to be absorbing most of that agent, and it won't be missed because they didn't have enough fat in the diet or take it in a proper way. On my last slide, I've given you my email address, so if you want to have any more information about the Superfecta supplements, I would be happy to email you basically the summary of 4 chapters from a book that I just published called The Niacin Breakthrough. But the last 4 chapters are the Superfecta agents that we've just talked about. So I'd be happy to share what I didn't have time to talk about here in this talk if you want to email me a request. So thank you very much. Happy to have shared this information with you.